Start lecture and start recording. Today we're going to be finishing up the cardiovascular. I'm going to do a screen share and then I'm going to move this and we're going to start with arterial sclerosis. So what is that? Basically, it is when you have blockage of the arteries. And this occurs for a lot of different reasons. Some people, it is a genetic issue. Some people, it is a diet issue. Some people, it's from lifestyle, and some people, it's medication, drug related. And there's different various forms. There's real mild to severe. And this picture is a good example. So we want, like we've mentioned, multiple times, we want our arteries to be open, flexible, and able to move the blood and the oxygen and nutrients throughout our body. We do not want plaque, and that's our fat deposits. We don't want anything blocking or clogging our arteries. And that's what this is. And because if this happens, it can slow down the flow of blood and oxygen and the nutrients to the areas it needs to be delivered. And high blood pressure is one of the big causes. High cholesterol, high triglycerides, smoking. We know cigarettes are definitely a major cause for this. And obesity and diabetes, because I've mentioned a few times how diabetes literally affects every aspect of our body. If it can get its claws in on something, it wants in on it too. So if it's something neurological, oh yeah, I want to cause more issues with your nerves in your feet. Or if it's cardiac related, it's like, oh, okay, here, let me add to that too. Diabetes is a silent killer. It honestly brings about complications to any type of disease or illness that you get. And we see that now, like with COVID, it's causing, a lot of diabetic patients having issues getting well, healing, and doing better. Some people who have autoimmune diseases, like rheumatoid arthritis and lupus and stuff, they're more prone to this as well. So what is the treatment? Well, the treatment is keeping your cholesterol good. So and then here's a big thing. Everybody asks, and we'll talk about this a bunch when we talk nutrition, but what age should you start getting your cholesterol checked? Now? Your 20s. Because you need to be watching that your entire life. Because we know so much more than what we did 30, 40 years ago. Cholesterol plays, when you have the bad cholesterol, the LDL, and it starts building up in our body, and that causes all kinds of cardiovascular issues. Now, we do know that we have good cholesterol, and that's our HDL. And okay, this is going to seem really corny, but here's how I always remembered the differences between LDL and HDL. One of my teachers a long time ago told me, okay, so LDL is the lipoprotein. It's bad, right? They're like, okay, so it's the low density. We want that number to be low. We do not want it high. So you think about it like this. Lucifer, right? The devil is in hell, right? Because he's low, it's bad. And he's low. So that's where we want him. We don't want him up and high. And then they said HDL stands for heavenly, because it's the good cholesterol and we want it high above and high. I know, like I said, corny, but it helped me always remember it. And y'all do need to remember that. You do need to know that LDL is the bad and that HDL is the good. Because your patients are going to ask you that. They're going to be, what does this mean? And we know triglycerides is another, and we'll talk about this during nutrition, but it's another one that we want low. And now I think the average thing is we want that total cholesterol number to be under 200 when they add all those together. But we'll talk about that later. So the best treatment is maintaining cholesterol. Exercise, activity, controlling blood pressure, and eating the right foods, staying away from the fat, greasy, high in trans fat foods. When we talk nutrition, we're going to really get into looking at your labels and looking at certain things, and we're going to find out that trans fat is evil, and it's a major cause to a lot of these cardiovascular diseases. All right, I'm going to post this video in Teams. Not that you will run across this very often, but it's talking about a cardiac tamponade. And so I'm going to post it so you understand what it is and how they treat it. And they treat that with a cardiocentesis. And this is like in the movies, they see where they stick the needle in the heart and they draw out the foot. So it's like real dramatic. But I've seen one of these done in the ER, and it was pretty cool. But it's not anything I've ever done or been a part of. So, but like I said, it's neat to watch as far as the video. All right, the next thing we're going to move on and we're going to talk about is cardiogenic shock. Oh, goodness. Hold on. Where did I go? Okay. Hopefully y'all can still see that. So cardiogenic shock is when the cardiovascular system is suddenly interrupted. There are signs, there are symptoms that our body is telling us that it's not doing well, and it's not pumping the blood, it's not supplying the oxygen that it's needed. And a lot of times we associate this with a heart attack. There could be other causes for it as well. But cardiogenic shock symptoms would include rapid breathing, a loss of consciousness, tachycardia, a kind of sweaty, clammy, what we call diaphoresis, where their skin just feels moist, cold hands and feet, and the patients might have an altered mental status. All of these are signs that, hey, something's really wrong. Treatment for cardiogenic shock is going to be emergency life support. We have to do something, we have to do it right away. A lot of times this includes blood thinners like thrombolytic type drugs, stents to open and repair arteries that have been occluded, and at times heart transplants. Carditis basically means inflammation of the heart. And this one right here is showing you myocarditis, right? So it's the muscular layer of the heart has inflammation. Well, do we want inflammation anywhere? No. But you can also get endocarditis and you can get pericarditis. And so the endo being the innermost lining. And that's usually, we see that with bacterial infections. Myocarditis we can see sometimes with viral. And then pericarditis can be heart attack, infections, and different things like that. But basically all I need you to know is carditis means inflammation of the heart. That's what you would want to write down and know. All right, the next thing we're going to talk about is CAD, or coronary artery disease. And this picture gives us a really nice example. So we throw a lot of things on our body over years of time. And our heart is nonstop, constantly working. We don't think about when you're 17, 18, eating, triple cheeseburgers and the smoking cigarettes or something like that. We don't think about that. We don't think that, hey, this is how we start out. We start out with nice, normal looking arteries. And over time, if we don't take care of ourselves, those arteries can develop plaque and hardening to where that they're damaged and occluded and there's not proper blood flow. Coronary artery diseases can range from no symptoms, which is really scary, to like heart attack-like symptoms, and nausea, sweating, lightheadedness, tachycardia is common. So what are the treatments? How do you prevent this? The main thing is, or how do you treat this, is the main thing you want to do is prevent it. You want to prevent your arteries from getting in this state. So that all has to do with, just like the previous slide, it has to do with eating right, exercising, maintaining. If you have a health condition like high blood pressure, keeping it under control. If you have diabetes, keeping that under control. And making sure if the doctor puts you on a medication, you take the medication, you follow up, you follow the orders that the doctor has given you. Now, sometimes if it occurs, their treatment can be something called angioplasty, and basically they go and they repair this, and they repair the area of damage. They can use that sometimes by stents or actual vascular repair. So, but we don't want that. We don't want to get to that. So like I said, the best way is prevention. CHF, and by the way, when I say these abbreviations, you need to know what they stand for. CAD, coronary artery, right? CHF, congestive heart failure. And CHF is something we usually see with people who are older, because as our heart gets older, it becomes weaker. Somebody who has a heart condition, could be congenital. Somebody who doesn't have, maybe got an infection or got some type of disease that caused their heart to be impaired. It's because what ends up happening is the heart's just not pumping. And you notice here where it takes effect is in the ventricles. And signs and symptoms that we see a lot with people with CHF is difficulty breathing, because they're not having that great relationship to cardial and pulmonary. And then the next thing is we start seeing swelling and swollen feet and legs and things like that. And that's because of a fluid backup. And that fluid's not able to process and move in our body, and it usually accumulates in our lower limbs. I'm so sorry. Treatment can include eating less salt. And the first course of treatment is prevention, staying healthy. But like I said, some people are, born with defects and stuff like that. If the doctor prescribes medication, taking the medications. And in serious cases, their doctor may place the patient with a defibrillator or pacemaker on the heart to monitor the the rate at which it fires, because these ventricles are not able to assist and do like they should be doing. So a pacemaker helps in that process. All right, now I know we've talked a little bit about myocardial infarction, and that's an MI, and that's a heart attack. So we know that when the heart that has its own blood supply, if that blood supply is decreased, blocked, stopped, a heart attack can occur. A heart attack is a medical emergency and should be treated as one. It should be something where 911 is called. If you're working in the office and you suspect somebody of a heart attack, you'd want to immediately contact depending on the protocol. Some offices will say, get the doctor first and then call 911. But then other doctors' offices have protocol where it says call 911 and then come get me. So it's going to depend on the protocol where you're working. And here's some information that a lot of people don't know. Most of us know the typical symptoms of a heart attack: pain in the chest, jaw pain, and pain radiating down the left arm, and it feeling like a crushing weight on your chest, difficulty breathing. Those are what we call the classic symptoms of an MI. Now, some people don't have any symptoms. We call that a silent, all right? And those are scary because there's a lot of times there's no notice. But what we have found out throughout years of studying this is that women are very likely to have what we call not typical or atypical symptoms, where men have that chest pain, jaw pain, left arm. Women might have things like severe indigestion, upset stomach, reflux, a lot of gastrointestinal type of things, pressure buildup. But so anytime you suggest if you think something doesn't feel right, it's always better to go with your, as a paramedic, I always went with my gut. And anytime I had a woman and she was over her 40s and complaining of, not feeling good, any type of gastrointestinal or this, that, I always hooked her up anyway, just to be safe. Now, if it turned out it wasn't cardiovascular related, I usually didn't bill them for that, but we won't tell nobody. Treatment for a myocardial infarction or MI has improved throughout the years. Let's go back 60 years ago. You had a heart attack and it was usually death. Now, you have a heart attack and they catch it and you're able to go to the doctor. You're able to lead usually a normal life afterwards if you follow your doctor's advice and change your lifestyle and your habits, meaning walk, work out, or take your medications, change your diet, stop smoking, and reduce your stress, right? People have a much higher success of survival nowadays than what they used to. We do stents, bypasses, and there's all kinds of treatment available nowadays. I want you to take a look at this picture here. This picture is something that if you ever notice, and I mentioned this before on one of our last lectures, so we know our baseline, right? But here's our P and our QRS, but where's that T supposed to be? That T is supposed to be down here. But do you see how that T is elevated? And so is the ST. Anytime you see an elevated or peaked T or ST segment, it should immediately jump out at you Why? It should immediately stand out and say, ruh-roh. And what I usually would do is I would circle this, and if I'd bring it to the doctor's attention, usually immediately, hey, and they'd be like, oh, okay. Now it could be from a past MI, or it could be an active MI, and it may not be MI at all, but it's definitely something. If you ever see elevated ST, it should be something that's brought to the doctor's attention. I don't think any doctor would ever get mad at you for, noting that, or, tell him, hey, Miss Jones in there's got an elevated ST segment. I don't think any doctor is going to be mad. I am going to put this video as well into Teams, and it's basically what it's going to go over heart attacks. This is a word I want you to know, and most of us know it, but cyanosis. Cyanosis means that the patient is blue or discolored, like in a bluish color, and that is from a lack of oxygen. Cyanosis is a common thing we see with cardiac cases. We'll see like a blue tinge around the lips, inside the mouth, the fingertips, the fingers, the toes, and this is a warning sign. It's the body telling you, hey, I'm not getting enough oxygen. Increase the oxygen here. Now, this is where, and I mentioned this in a previous lecture, but a lot of people get confused and associate cardiac arrest with a heart attack. They are not the same thing. A heart attack, you still have a beating heart. Now, could a heart attack turn into cardiac arrest? Absolutely. But usually we're able to catch it, we feel them symptoms, and we get to the doctor, okay? Cardiac arrest is when, and you need to know this, when there is total loss of the heart functioning. There's no heart beating, there's no breathing, there's no consciousness. So it's basically the patient is dead. Cardiac arrest can happen for a few reasons, like electrical disturbance from the heart, from some type of arrhithmia. It could be from a heart attack. It could be from drug overdose. It could be from electrocution. Those are all ones that I've seen. And can a patient be brought back from this? Yeah, they can. But it's not one of them things like, oh, hey, I brought you back, you're good to go. See ya. No, it's like, oh, you were at cardiac arrest. I mean, you were dead. We got you back. You're going to be in ICU for a while, and, nothing's ever going to be completely the same in your life. Because when your heart does stop and there's that disturbance, changes everything, okay? The immediate treatment is CPR and the use of a defibrillator. And this is why we have the AEDs everywhere. This is why all of our malls, amusement parks, things like that have, the signs, airports, AED. Because if somebody is without breathing and a pulse, you want to start CPR, have somebody call 911 and have somebody grab a AED. Because a lot of times we can reverse this and be able to improve their outcome. All right, we're going to talk about hypertension, even though I know we've talked about hypertension quite a bit. But hypertension is HTN. And I know that we've talked a lot about hypertension, how high blood pressure affects our overall health, how it damages the arterial walls and can have long-term effects on the heart and so forth. But we're going to get a little more, a little more into it, a little more in depth. First and foremost, you need to know that's the abbreviation. And let's talk about symptoms. Most people who have hypertension, one of the first things they're going to tell you is they got a headache. In very severe cases, they may even have a nosebleed. And that a medical term for that is called epistaxis. And that means that the pressure is so high that it's causing the capillaries to burst and the nose to bleed. We know a few things. We know that if hypertension is not treated, it can lead to death of the patient. So it's not something to play around with. It's not something to dismiss it and I'll be okay. It should be, if your doctor says, hey, you have hypertension, I want you to take this diuretic, it's going to help you pee more to bring down your blood pressure, and I want you to no more salt, change your diet, listen to them. We need to do what they say, but we know our patients, and most people are stubborn. Most people don't want to listen. When the doctor says, hey, no more salt, take this medication, get rid of the fatty fried foods, they just don't listen. And one of the main causes that we know that pertain with hypertension is cigarette smoking. And we still see people, puffing cigarettes all over the place. I can't tell you how many times as a paramedic I would see some patient who was on oxygen at the corner of the block, smoking a cigarette, pushing an IV pole. And it's just like, what? Are you kidding me? But you believe it or not, it's happened so many times I can't even count. The other issue with untreated high blood pressure or hypertension is that it ends up killing your kidneys. Because when we talk urinary, we're going to find out that our kidneys play a massive role, because there are filters, right? The filters of our blood, and they're the filters, and when the blood pressure is high, they're working even harder, right? And they're highly vascular. And when all of that massive volumes of blood continuously flow through them because of high hypertension, it weakens and stresses the kidneys. And it can lead to kidney issues where the patient ends up having kidney failure and can lead to dialysis or permanent loss of a kidney. This is a chart that I shared with y'all, and I told you I wanted you to memorize it because you really need to know that. There's a few things that should just stand out. You should know a normal blood pressure. The normal blood pressure, systolic, should be 120 and less, and the diastolic should be less than 80. So 80 and less, right? Pre-hypertension, this changes every so often. In the last 25 years, it's changed, all right? This used to be a little bit higher. Now, we're seeing that, hey, pre-hypertension, you're yellow, it's time to lay off the salt. Maybe time to stop smoking. Because if we start seeing numbers like this that are steady and constant, it tells us that our heart's working a little bit harder than what it should. Now, if you don't, it can lead to hypertension, stage 1. And that's anything 140 and above, and 90. So 140 over 90. Stage 2 is when you start seeing blood pressures with the systolic of 160 and the diastolic is 100. This is really bad. This is not something we want to see our patients stay with a continual day-to-day blood pressure. And then a hypertensive crisis, which is an emergency. If you ever have a patient that comes in and their systolic is over 180 or their diastolic is 110 or higher, this should mean you immediately alert the doctor, depending on what your protocol is at the place you're working. But this is a 911 because our heart and our vessels and our kidneys cannot sustain this. This is a severe hypertensive crisis, okay? Now, the opposite of hypertension would be hypotension, abnormally low. Now, I know I've mentioned this. This may be normal for some people, like myself. I always have teetered towards the low end with blood pressure. But sustained hypotension is anything 90 systolic or 60 diastolic. So 90 over 60 or lower. Now you're saying, now if they are completely asymptomatic, means no signs or symptoms of having issues, and they're talking to you, they're active, then is that something you're going to really worry about? Probably not. But if they're symptomatic, dizzy, lightheaded, fainting, this is a word I want you to write down, syncope. This is the term we use medical to refer to fainting, is syncope. If they're starting to have blurry vision or nausea, fatigue, they're not able to concentrate, these are all signs, hey, your blood pressure is too low. We're not getting enough blood and oxygen to the areas that we need to be getting it. And that's why we're having these symptoms. Causes of hypotension, sometimes age, sometimes infection, a lot of times endocrine issues like thyroid, blood loss and anemia, dehydration. Somebody who's been sick, vomiting with the flu for several days might present with hypotension. And then also it could be a vitamin related thing. We know that vitamin B12 is a big issue with not only anemia and so forth, but also a cause of hypotension. The treatment, so how would I treat somebody who has hypotension? Believe it or not, this is one of the few times the doctor is going to tell them, hey, increase your salt, drink more water. And sometimes the doctors will have, especially the little old ladies, tell them to wear them stockings that, put the compression around their legs, and it keeps still allows for blood flow, but it keeps the majority in that core area. And then there's, of course, prescriptions that can help with chronic hypotension. All right, the next thing we're going to talk about is, and I have a video for this, and this was one of your questions. What is FAST? All right, FAST is the acronym that we use if we think somebody is having a stroke, is the lay term, but we're going to refer to it as a CVA. And a CVA stands for cerebral vascular accident. And it basically means stroke, but remember, we're medical professionals, so we're going to start using the big words. So a CVA, so what does that mean? Well, it means that the brain is going without the proper supply of blood. Now, that could be for several reasons. A stroke, or CVA, is a medical 911 emergency. Symptoms is right here. We start seeing a drooping in the face, right? Weakness or paralysis on one side, arm weakness, right? Speech, slurring their words, not making complete sentences, not understanding or comprehending properly. Some patients can even lose consciousness. Now, the T stand, we have that there for time, because T is vital. If we can get a patient to a facility where they can be given medications, we call them clot busters, but they're called TPAs, and it's basically medication that goes in there and cleans everything out and opens back up anything like blocked arteries or anything that resulted in this, or sometimes surgeries are necessary. But if we can fix the problem within a few, like an hour window, we can save the person's life, or prevent serious long-term complications and damage. All right, how do we prevent a CVA? The most way, and you're going to start seeing, hey, all of these have something in common. Don't let it happen in the first place. Have your cholesterol in good range. Don't smoke cigarettes. Don't eat a diet high in fried, fatty foods. Stay away from trans fats. Make sure you keep your blood work and that kind of thing. The best way is, like I said, prevention. So I need you to make sure that you do know F is for face, A is for arm or weakness, paralysis, S is for speech, and T is for time. And that's why they say what's fast, and that's what that means. And I do have a really great video I'm going to post, okay? The next thing we're going to talk about is thrombophlebitis. And so we see itis. So what does that automatically tell us? Inflammation. So this can happen for different reasons, but we see this sometimes with patients who have deep vein thrombosis, or people who set a lot, who cross their legs, who do not have good vascular flow, diabetic patients, severely obese patients. And this is bad. This inflammation is bad because, we don't want DVT or deep vein thrombosis to occur. We do not want the patient to develop a pulmonary embolus. It's going to lead to death, and that's because that's a blood clot. A thrombus means you have a clot, and an embolus means that clot's broke off and now it's traveling. Those are dangerous. Those are life-threatening. So what is the treatment for thrombophlebitis? I got this because I let a student draw blood on me, and whatever the reasons were, I don't know. I could have sworn I was talking. I had two students taken. This is back when I used to let students draw blood. Here's an arm, go for it. But I don't do that anymore, because after I got thrombophlebitis, inflammation, I said, nope, no more. And what the doctor had me do is, first they checked to make sure there was no clots, which there wasn't. And then they had me place a warm compress on it. They gave me anti-inflammatories and stuff like that. And eventually it went away, no complications. So, but it did, like I said, it taught me a very valuable lesson. Not to play pincushion. And that is the end of our slides. Thank you for joining me, and make sure if you have questions or you have any comments, concerns with any of this, get with me and let's go over it, okay? Y'all have a wonderful day. Make sure you hang up from the phone call and I'll upload this to YouTube. Thank you. Bye-bye.